what's on the program might be slightly different in terms of title, but we are going to be talking about new technology and how it has the potential to change healthcare and prevent the next pandemic. Now, quick backstory, and first of all, I can't say thank you enough to the support team who's actually been able to put this all together. This is not easy. It's also being live streamed as well across 3 different live streams and being recorded live. So thanks everyone from the Healthera team. Now, firstly, a little bit about myself. I graduated as a dentist in 2006 with a double degree in honors in dentistry and in science. I also was accepted as a fellow of the Royal Australasian College of Dental Surgeons with Resto and Perio as my focus. But that seems like a lifetime ago. That was 2012. Since then, I've run a number of clinics and understand the commercial problems facing dental practitioners. And in the last 2 years, I've forayed into management consulting, a specific type of consulting called strategy consulting. And basically we look at improving the business or company that we're dealing with in terms of efficiency, output, and effectivity. How effective a business is or how effective a company is, okay? Or how effective the healthcare sector is or how inefficient the healthcare sector is, okay? So yes, it's gonna be preventing the next pandemic or reducing the effect of, but the interesting thing is that we already have the resources now to be able to do that. We probably had the resources even about a decade ago to do that as well, okay? So what better way to start except talking about myself? So background in immunopathology, did some deep research as well into HIV at university level. Can't help but go and research it once I've actually experienced those symptoms. So this is my COVID-19 story. Most people get presents for Christmas. I got COVID. I woke up Christmas Day. I had a very rapid fire COVID experience. It was 3 days. I had a peak fever on day 2, which dissipated very quickly. I had 2 interesting symptoms, and it was reported in the media. Ageusia and anosmia. Is there any dentists here at the moment? Any clinicians? Do we have clinicians? Ageusia? Hazard a guess what that means? Gustation. Loss in taste. So I had loss in taste and loss in smell. But what I found really interesting was at 6 p.m. I was having dinner and it was fine, 100% taste and smell. 8 p.m. 2 hours later, 100% gone. I tried eating spicy food. I tried eating sweet things. I could not taste anything. I could not smell anything. And I thought that was bizarre. There was no gradation towards it. I was rapid antigen test positive because my wife was very concerned that we wouldn't be able to make Christmas dinner that night. So she put me through the rat test. She did not seroconvert. She was negative on the rat test. And she remained asymptomatic. And even though she didn't say it, she was gloating about it and she was telling everybody. So I was double vaccinated. I didn't have a 3rd booster shot or anything like that. I thought about it. I got back to Sydney. I believe it was just one experience where I went shopping, forgot, sort of absent-minded. I didn't wear my mask when I went to Woolies, Christmas Eve, Sydney. It's hectic. So it's statistically likely to get it. But I had a rapid fire experience. I didn't have a terrible experience. I would be lying if I said that, it was a really terrible experience. It was just, I was sick earlier in the year. That was a lot worse. I had pneumonia, a lot worse. Poor air conditioning. That's what I think it was. So I went very deep into the research because I was very fascinated. Why did I get this loss in taste and smell that I'd read about? And then all of a sudden I'm experiencing it. It's very categorical of COVID-19. If you get these symptoms, you pretty much have COVID-19. However, I got it after the fact, like I was recovering and then I got these symptoms. I found that very strange. I suppose one of the strangest things about COVID-19 is how strange it is. There's a simple explanation for it. Varies between 20 to 76% of patients That's very variable. So they've done a lot of research, and the best they can tell is that it affects ACE2 and transmembrane protein function and the receptors of cells. And it gets in through those receptors. Do you remember what ACE2 was from university? Angiotensin converting enzyme 2. Involved in blood pressure regulation, but it's also got a crossover with other things as well, yeah? We got anosmia, direct damage of the supportive cells is one of the theories. So that's a smell. Now, the research goes into detail, but actually it's relatively simple when you think about immunology on base level principles. One, the innate immune system is always operating. The adaptive immune system is when cells are fired off and then we produce antibodies. We can artificially encourage those antibodies through vaccines. So the body mounts an immune response, surprise, surprise, through the cells that line the respiratory tract, the nose, and the lungs. What is a problem with COVID-19 is that it's the degree of response that it initiates from some people, at-risk people. So what they call immunology is you've got an attack by a virus or a bacteria or anything, there's certain molecules released, and for the non-medical people in the audience, some of those inflammatory molecules are called cytokines. And you might have read in some literature that it's a cytokine storm. So the body responds, there's a cytokine storm, and sometimes the immune system overreacts, and what happens is that healthy cells are destroyed in trying to remove the virus. If you're immunocompromised, or if you don't have the best of health, that can result in a lot of damage to the lungs, pneumonia, inability to breathe properly, why you need a respirator, why you have low oxygen levels, and why in some people, they're unfit, they're old enough, unfortunately, they will pass away. And I'm just curious, in this audience, does anyone know someone who passed away as a result of COVID-19, directly or indirectly? One person? Couple? Does anyone know how many people died of COVID or have died up to this date? Rough numbers globally? 5 million. That's about 0.7%, I think, of the world population. And then you've got agousia, which is more unknown as to exactly why it happens. Why does taste get knocked out? Obviously, it's secondary to smell. Taste is intricately connected to smell. But the direct mechanism is a little bit unsure. They don't really know why your taste gets knocked out. Okay? Any questions? Anything at this moment? We're live streaming, so we'd like to get the questions afterwards. As long as, Logan, you can keep me on track. So why do we get those unusual symptoms? Why do we get that variability? It's because COVID-19 species jumped. It's not a human virus. Interestingly, it's bats, cats, which hopefully you'll remember if you just remember the bats and cats, but it's also bats, cats, and dogs from which we obtain, or these species jumping happens. It probably already happens anywhere at home right now. You probably share viruses with your dog and cat already, but they don't cause symptoms. And then we have the bats down the bottom. They were basically, victimized during COVID-19. Or was it these things? We don't know. We don't specifically know. It doesn't really matter because it's the fact that its species jumped. And what's interesting is the most recent research that you probably haven't heard about is that its species is jumping back into animals. That's correct. So the virus mutates, and now it's actually jumping back into bats, cats, and dogs and killing them. What am I trying to say here? Does anyone want to hazard a guess as to what I'm actually trying to say here? COVID-19 in the popular media has been all about humans, correct? Losing loved ones, everyone getting infected. What's going to happen next, right? We already know what's going to happen next if we watch these patterns. How many animals have been extinct since humans have been around? Quite a lot. So if we don't deal with this, effectively what we mean is we're dealing with the extinction of more species. That's right. It's Fido, Dido. It's your cat, it's your dog. And when I mentioned this to Logan, Logan was like, how am I going to protect my dog from coronavirus? Dogs have paws, cats have paws, we know that, right? Unfortunately, they cannot hold anti-vax rallies. They have no say. So what we're looking at is potentially the extinction of more species if there's repeated viruses that keep jumping from species to species to species. This is not like the beginning. It's the beginning in one way, but it's going to keep happening and has happened already, and they're all just warning signs of what's happening ahead. So may I ask, what is your clinical background, or is it you're a dentist? Okay, where do you practice, may I ask quickly? Huh? Parramatta? Okay, in Sydney, yes. Can you hazard a guess as to potentially, I don't want to like, worry anyone as such, but what's the next species that could be rendered extinct if you look at the timeline for long enough? It's a trick question. Anybody want to throw it out at me? Humans. You see things on a long enough timeline, eventually, yes, that's it. We're at risk as well of getting wiped out. Maybe not completely, but it's already happening in the sense, there's a little bit of death and disease, but it could repeatedly happen. Anyone know what this is? Winston? No? This was, I think, a disk sent out on a probe called Voyager 2, which has now gone well beyond our solar system. In case any extraterrestrials found this, and this explains us, supposedly, on this disk. It's human civilization, like simplified to this disk. Okay, so I'm going to cheat a little bit. I didn't come up with these definitions. Our CTO, who is basically a PhD in AI, he came up with these simplified explanations of what AI is. And I will link the concepts together. I'm hoping people can link it themselves, and so I don't have to spoon feed them as such, but we will link it together. Generally, artificial intelligence, or AI, is the development of computer systems that can perform tasks normally requiring human intelligence, such as visual perception, speech recognition, and or decision making. Just basically mimicking what the human does. Unfortunately, I think we're quite far away from AI understanding abstract concepts or ideas, I don't know who talks to their Siri or Google Assistant, but ask Google tomorrow, define beautiful. Specifically in the healthcare industry, AI is an overarching term for the use of such software and machine learning algorithms like deep learning to mimic human cognition in the analysis, presentation, and comprehension of complex medical and healthcare data. We've got a few clinicians in the crowd. Any more clinicians that have joined, or we just got the two clinicians? Yeah, two dentists. Anyone else? Dental assistants? No. Anyway, it's very complicated what we do on a daily basis, or what I used to do on a daily basis is to interpret X-rays, cone beam CTs, what I'm seeing in the mouth, and putting it all together and then making a diagnosis and treatment plan. It's very difficult. Artificial intelligence can do it very quickly if it's fed the right kind of data in what they call big data form. And I think I did some research 2 years ago, and I had a look, and I thought, me and Zora specifically, were quite progressive in AI, talking about AI for years, but it's already being used quite a lot. Precision medicine, genetics-based medicine, drug discovery and development. It would have been very helpful if we had all that data available being collected to be able to analyze the coronavirus quicker and to be able to produce a vaccine quicker, possibly even automated. And even at this seminar, we have Eyes of AI and Smilo.ai. I don't know where Padma was around before, but we're already using AI in the dental industry. And Eyes of AI is Hua. He's an ex-management consultant, and he's working, I think, with his brother, who's a dentist, on Eyes of AI and image recognition and diagnosis on X-rays. This will just accelerate the process. It's not going to supersede dentists. It's just going to make things very quick for us to be able to pick up problems on an X-ray or cone beam CT in 3D. Always struggled with understand cone beam CTs. Smilo.ai is basically assisting patients to self-diagnose and self-report and pick up problems before they get worse. I think they're just housed over there. There's Padma, right? You can see it there. Blockchain. I don't think any software, which is really what it is, or technology, has got as much interest as blockchain and Bitcoin. Anyone has bought Bitcoin? One? Only one? Two? Only 2 people have bought Bitcoin. When did you buy it? I can't hear you, sir. 2 years ago. Do you think you got a good price for it? You think so? Okay. I'll show you some slides where you'll be very disappointed, I think. Sorry, man. The story behind an underlying Bitcoin is fascinating, right? It's an anonymous guy or people coming together and creating this technology, this software which tracks transactions, and you don't need an intermediary like a bank or anyone to track these transactions. You guys look at any dollar notes, like $20 notes, $50 notes, or whatever, the American dollar notes, you'll see all these like registration codes. Yeah? Identification codes on the money. Anyone wonder why there are registration codes on the money? Ever wondered why? Winston would be able to answer this. Because he's wearing, you went to the Reserve Bank of Australia, right? They just print money, right? They just print it. And so they need to track where it goes. That's it. And so these guys created, and Satoshi Nakamoto created a way that you don't need a central bank or a mint or anything to track transactions. There's no scam or pyramid scheme. You know, I still see it in the media 14 years later. There is no scam. What's the other one? Pyramid scheme. What's that? Dallas, what's that one where it's a Ponzi scheme, right? It's not a Ponzi scheme. It's one of the world's biggest Ponzi schemes now in the world, and everybody's in on it. So I don't know if it's a Ponzi scheme anymore. A blockchain is a decentralized, distributed, and oftentimes public digital ledger consisting of records called blocks that are used to record transactions across many computers, so that any involved block cannot be altered retroactively without the alteration of all subsequent blocks. There is an exception to that rule, which is if you own 51% of Bitcoin or the network. But then it's no fun playing on your own with a currency that nobody else wants to trade, right? Blockchain is also being used. Oh, no, here we go. Sorry, mate. Was it 2 years ago? 29th of April, I remember that day, that's my sister's birthday, 29th of April, 2013, the price of Bitcoin was $144.54 USD. 2013. 2 years ago. 11th March, 12:49 a.m. $39,340.80. And I think people have become so used to like thinking about cryptocurrencies and normal currencies that is like mind blowing. One USD, what does it buy you? $1. You owned one Bitcoin? If you paid $144.54 in 2013, I'm going to say it once, only for the record, but I've said it multiple times. I'm no high-level business analyst, like, well, now Winston's gone, and fintech and, you know, investing and all that, but there is no asset class in the last 12 years that has performed as well as Bitcoin. Not even close. Through all the ups and downs and the scams and the blah, 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 not one asset class, unless somebody can tell me what you should have invested in on 29th of April to get the best returns on your money. Use cases of blockchain. So it's starting to be used in healthcare, but not very well. I'll openly say that, and hopefully I don't offend any blockchain projects or anything. It's being tried to be used in patient data management to make patient records anonymous. It's being used in genomics. I don't exactly know how, but I need to look into it a bit more. Improve patient-provider communication. I don't really understand that too much, but this is where it's being used. Quality control and assurance. That's very interesting. We're interested in that. And what I think is really amazing is it enables siloed information to be accessed, which is absolutely critical. So what I've been saying is AI is our savior and blockchain is our enabler. What do I mean? So at the moment, we obviously picked up a lot of information when we diagnose someone with COVID in the hospital setting or a nursing setting or a whatever aged care setting, right? That data was collected, but most of the time it's housed locally on servers or in the cloud on servers like Amazon Web Services and things, yeah? Does everyone following me in general, yeah? In the cloud. That used to be very confusing 10 years ago to everyone, right? Now we're able to store it in a decentralized fashion. And what I find interesting, or way more interesting than Bitcoin, is Ethereum, which was invented by a 19-year-old kid called Vitalik Buterin. And that technology basically improves Bitcoin's underlying technology blockchain and introduces this thing called smart contracts, which is basically digital contracts. They replace paper contracts, potentially making lawyers obsolete. Dallas, who knows well about this and why he jumped onto the project. So effectively, you got digital contracts, but the interesting thing is that digital contracts can be exchanged between people, but also machines and databases, which means by the time we capture the data at point of contact with a patient, whoever it is, and that data is captured in a decentralized fashion using smart contracts, that data can be distributed to pretty much every academic institution, every government regulatory agency within seconds. So what you have is literally a global response to COVID-19 if you get the data to the people who can analyze it within seconds. Does that make sense? Or is anyone not understanding what I mean by decentralization of data and spreading that same little bit of data all the way across the world? No? A little bit, yeah, sort of. Anyway, smart contracts, Ethereum, it's already there. Technology is already there. This was the buzzword about 5-6 years ago. Data, internet, well, buzzwords, data and internet things. They talk about data being the new black oil, blah, blah, blah. Internet of Things is basically devices embedded into things like fridges and stuff. Now, I was in a big think tank conference in Silicon Valley in 2015. Little company called Cisco, if anyone's heard of Cisco. They were already embedding their chipsets in 2015 into everything. And I think I remember the statistic of something like 85% of devices that already had chipsets embedded, everything already. They just hadn't been turned on. So we can gather a lot of data, and we do already gather a lot of data in geographic, settings, epidemiological statistics, population statistics, and we can mine that data. We can look at for patterns, satellite imagery, human data collection, i.e. monitoring. That's the thematic of the Healthcare Week conference downstairs, 2 levels down. It's all about collecting data. They're not sure what they're going to do with the data. That's where we come in, Healthera.AI, but they're collecting a lot of data, remote patient monitoring, etc. We've got animal population data, sensors, microchipping. We track them already, yeah? We already track them, right? Yes, endangered species, not impossible to track them via GPS. The combination of all these, if everyone can kind of keep up, is early detection, diagnosis, and management. That's all it is. So now we're going to talk about what we are now and what we want to do and where we're at. Healthera.AI is, yes, I'm the guy with the ideas, the big ideas. Why do I talk sense, unlike maybe, you know, other CEOs of healthcare companies? I've got a background in immunology, deep background in immunology. Obviously, I did Bachelor of Dental Science. I didn't do too bad, graduated with honors. And I also did the fellowship, which is kind of like a master's degree. So the stuff we're talking about and doing in Healthera.AI is not beyond the realm of possibility. Yeah, and we've got a second dentist as well involved, Dr. John Hegliasis over there. So most of the stuff that we've sussed out, we're like, yeah, okay, this is possible from a clinical standpoint, from an immunology standpoint, what we're talking about. But we have Dallas over there. We obviously have Zoris as the CTO, and we have our accountant, Albert. Did Albert disappear on us, guys? I can't see him anymore. He's heard this story a few times. We realized that the application of artificial intelligence, the top layer, and blockchain would be most suitable for finance for the healthcare sector, which is currently clogged up. I have anecdotal, direct stories on a day-to-day basis that's correct. Dentists, doctors, OHTs, hygienists, nurses. For some reason, nurses find it difficult to get finance, and the banks don't see them as high lending value. Dentists and doctors are pretty good, or historically have been. So the buzzword, and in the truest sense, decentralized finance, if you understand blockchain and crypto, that's not what we're doing as such. But what we're doing is we're consolidating as many lenders on our platform to come to the table to provide financing through our app to dentists and doctors or ARPA registered professionals. That's the use case for us. Why? We'll come to it later. And I'd like to say this, like blockchain, in my opinion, once again, in my humble opinion, not having a finance background, but understanding fintech a little bit and having, you know, Dallas and Albert and a bunch of other people, Winston, who was here before, explain it to me, is blockchain is, it could be viewed as a fintech revolution or an evolution, right? Like a slow progressing thing. No, and if my colleague Armin was here, who speaks on this and has been speaking on this for like 10 years, it's a revolution. Yeah. One of the podcasts, I listened to a podcast and one of the guys was speaking, you know, finance guy, and he said, it's actually a renaissance. We're going through the renaissance. And Winston said I should talk about Web 3.0, decentralization of data. And really, my CTO, Zara, said, blockchain is Web 3.0. It's a revolution on how the money system works, which has been around for a long time. 2008, the theoretical white paper was launched, and we've been using it for 14 years. And you've heard in the media about hacks and network security events, etc., and all that. Effectively, the underlying database of Bitcoin, which is tracking those transactions, that ledger, that decentralized ledger, has never been hacked in 14 years. The database has never been manipulated, ever. The problem occurs is when people forget their e-wallet passwords or leave their wallets on or get caught up in the latest crypto scam, you know, send 0.006 Bitcoin here and Elon Musk is going to send you 3 Bitcoin back. What we're doing is basically automating a long-standing business model. It's very inefficient, and I didn't realize this until I fell into fintech, because it's dragged into fintech. sort of against my will to some extent. But anyway, it was just automating it and making it quicker. So we're talking about application approval and deployment of funds within seconds. Have you bought a piece of equipment on finance? Have in the past? Never? Just always cash? Okay. Doctor, you have? What did you buy? A chair? Okay, yeah. So we're not even talking about like getting an approval and getting a quick turnaround. We're talking about we trust you enough, as long as you provide details and evidence of this dental chair and the supplier and the invoice, we will deposit the money into your e-wallet system, or e-wallet. It'll either be escrow held somewhere, or you'll literally have the cash within seconds, because that's how fast it works. The algorithm, once you do the application, it'll approve it based on pre-fed variables, and then you'll get your money in your wallet. Whether you decide to buy that dental chair or not, that's a different question, right? And we're implementing peer-to-peer functionality, or we have implemented it. We just can't sort of publicize it yet as well. So that effectively means that we become a self-governing type of industry. So instead of paying money back to the bank or another lender, you just pay back to the pool. We technically, legally cannot pool funds yet. Hopefully that will change soon. And then what are we doing? Why are we doing all this? Is just for giggles. Our CTO is very super smart, and we've been working on the algorithm, but he's been getting into the application of AI around fintech. And what we're really trying to do is assist in the prediction of default risk before it occurs. So enough data is fed in. Eventually, we can predict high-risk behavior of borrowing and lending, which prevents default risk. Not that dentists and doctors are going to default very much or easily or quickly because their license is at risk, but effectively that type of technology could be very useful for other sectors and high-risk sectors. So that's what we're actually doing. What's our long-term strategy? So as I said, I had a bit of push and pull when I said, I'm going to change my title from artificial intelligence, transforming the healthcare sector, to preventing pandemics. So yeah, at some stage, it doesn't make sense for me to be the CEO of a fintech. I've said that quite openly. I've got a deep clinical background and interest in clinical applications of AI and blockchain. So our long-term strategy is this, and this is the frame of reference that one should look at our company, and they should sign up. That's where the QR codes are there. If you're a dentist or doctor or a APRA registered practitioner, you can register on the platform and you can submit a borrow request right now. There are some lenders willing to pre-approve you for up to $500,000 with just your registration number and your ABN. It's completely legitimate, etc. We have an Australian credit license, which means we can farm out loan requests, as we've already been doing, to lenders of different types and peers who are going to assist, hopefully, their peers who can't quite get finance, even low amounts. So our long-term strategy is to accelerate the adoption of digital in the healthcare industry, accelerate the analog to digital adoption curve. Sir, are you using physical impressions or digital impressions? Combination? Sorry, I can't. It's okay. No worries. It's okay. Digital or physical impressions? Physical? Digital? What type of scanner? 3 shape. Okay. Trios 3 or 4 or? So what we're trying to do is basically get everyone to convert to digital. I've thrown out a figure, 80% before the end of the decade. If we accelerate how people can invest and upgrade their technology, access to capital, upgrading their infrastructure, working with suppliers, Restock is a company that we are we've already basically struck an in-principle partnership. We just want to accelerate the adoption to digital. We're not really facilitating sales of materials, except at bulk, but definitely equipment and big items, etc. That's what we're interested in. Anything that'll assist someone to move towards digital. Home loans, private lending, in time, we'll see. So if we capture the data in real time, then we can diagnose in real time and respond in real time. So early detection of the virus symptoms and cross-referencing that data with population and geographic data, we can potentially have early detection, localized quarantine, and disinfection. Just capturing it before it spreads. We can use AI to predict the next outbreak before it occurs. With enough data being fed in by willing health practitioners who want to join us on the journey or adopt the digital transformation, digital health transformation of the buzzwords in management consulting, it's being done in all the other sectors. Healthcare is behind. We can use AI to predict the next outbreak and limit its damage. Yes, this is my best work at drawing graphics. We have a graphics guy on board. I don't know why he didn't do this, but this is evolutionarily. This is our camps. We used to go and we used to hunt, maybe not bats. I don't know, some people eat bats, I think, as well. So bats, cats, and dogs and wolves or whatever. And we used to hunt, and then we used to take it and bring it back to the camp, and then we would eat it or whatever. We were really far away from animals. And guess what? If we got wiped out, with that camp got wiped out by a virus, that was it. That was the end of the story. They just got unlucky. They ate the wrong bat or played with the wrong cat. I don't know. So this is what we have today. So you look very engaged as a doctor. Oh, you're a doctor. You were pretending you're a doctor. Dr. Safar Suzani, Iranian. So would you say that occurs today, or do you think I'm just like making things up just to get attention? How much crossover do we have now? And why do we have that crossover? What made us feel like we can just get animals and then just put them into cages and just hang out with them for ages? Like when did we decide that was like cool and it was okay and we could do it? I'm not judging people having pets. I'm just saying, what point did that balance point change that we just went, yeah, this is what we're gonna do? It might say something controversial, but perhaps that bat in that cage's best defense was launching COVID, because it has no other way to defend itself against overpopulation and its habitats and encroaching, yada, yada. It's controversial, maybe, I don't know. The real aspect is, the real truth of it is that they don't know whether viruses are dead or alive. They just don't know. It's undefinable, which is, to me, a little bit creepy, a little bit scary, but it's true. It has characteristics of alive and dead. So that's today. How are we going for time? We wanted to allow some time for the questions about some of these things. This is where I really wanted Winston here, because this is what he loves, is data and data outputs and inputs and data outputs. That's what management consulting is transforming to, utilizing data, making better sense of it, etc. Is that, sorry, Dr. Suzani, just because I remember your name, I forgot your name. Sorry. That's all right. Is that impossible to do now? Genuinely. You know, you've heard of Fitbits, right? This is Fitbits for animals. Anyone worked out why we're trying to capture the data in animals as opposed to humans for COVID? Any guess? You don't have to have a medical, dental, immunology qualification to guess. Why would we want to capture symptoms and signs and stuff in animals? Who has a dog here, man? Who has a dog here? You've got a dog? It gets sick from time to time? Has it gotten sick? Have you taken it to the vet? Never? Every COVID, it got COVID. You gave him COVID, nice. You were featured early in the presentation, right? He got sick, she got sick. Well, how did you know it was sick? You got to speak up, sorry. It's pretty obvious. It was the way it was acting. Yeah, it gets sick too, surprise, surprise. It has symptoms and signs too. That's why veterinary science exists, right? big data, collection of data, pattern recognition, which we as clinicians do on a daily basis. We just have it in our head. It's called heuristic analysis. We generally ballpark what's going on in the world around us and we go, I think this is the problem. Let's take an X-ray to confirm it. Let's not take an X-ray to confirm it. Let's place that implant without a cone beam CT. And then prediction algorithms that are AI just get better and better and better based on big data. Once again, I'm going to keep saying this. Nothing I am saying is futuristic or 20, 30 years away. If anyone's seen Minority Report with Tom Cruise and they're predicting crime before it occurs, what year was that again? 2003 or 4? That was 17 years ago. I was still at uni. In 2022, we're already there. Like the LA Police Department uses AI to predict crime. Just goes, generally speaking, there's a lot of people here. Crime occurs here. It's always been reported here. So send a cop car there and see if there's a drug deal happening. It already happens. It has been happening. New York Times is my favorite publication because it's pretty balanced. Can an algorithm predict the pandemic's next moves? Too late. Too late. Too late. 5 million dead. Too late. Sorry, that sounds terrible and callous. 100 million people infected. Too late. Way too late. Lawrence Larry, and yes, his last name is brilliant, gives everyone a bit of a chuckle, warned the public about pandemics in 2006, or was it 2007? I might have missed, that might be a typo. He's an epidemiologist who warned us this was going to happen in 2006, 7. So better than me saying all this, and what we can do is let someone else say it, right? Can everyone hear the audio well? At home, I'm not sure how well they'll hear it. They might have to get this link. That is awesome. Which one do I connect to, please? Yes, thank you. Surprise, surprise, Harry. Oops. Thank you. Oh, you're about to, sorry. We tested this before, I swear. Wi-Fi seems to be a very difficult thing to get in the convention center. Paid or otherwise. It's only 1 minute, okay? It's only under 1 minute. 15 minutes, please. That's the cut clip. That's fine. I got it. Is your audio okay for everyone who's got headphones? Is it right? Sorry, I was wrong. Yeah, Jan 17th, 2007. And you don't think epidemiologists have been called in to advise governments, for example, I don't know, the US or China or India, China and India particularly, about how to potentially manage? Do we know, does anyone know of a world institution perhaps that's involved in their whole purpose is to assist in the health of people globally? Anybody guess what the name of this institution is that has been releasing reports for a decade or more about how to prevent pandemics? World Health Organization, nice. That's our contact details. We're going to have an extensive list of references: AI, crypto, immunology, extensive list. We just ask you to please go to the website if you're a healthcare practitioner or not. There is a section now for patients who are interested to know more about the truth behind COVID. I'm happy to take on anyone in any arena. This is a big challenge to talk about how COVID happened and where it happened and all that kind of jazz, you know, and whether vaccines work or not and how they work or why they work or why they don't work. Or even more interestingly, are vaccines the only way to manage viruses and outbreaks? Those are our details. I am not interested, sounds blunt, but I'm not interested in answering any tech questions, because although I have a good understanding of tech and computers and stuff, that is not my area of expertise at all. I've just picked up a lot of stuff along the way, really smart people around me like Zoris, who at the age of 18, 19 at university, he was building robots that assisted autistic kids to read facial impressions of people. At 18, he was doing this and producing artificial intelligence algorithms. He's 29, I think now. So artificial intelligence algorithms a long time ago for the Malaysian government to read number plates, to recognize the number plates, and also the make and type of the model as cars are crossing over the Malaysian-Singapore border. He's super smart. He's been applying himself for about 5-6 years actually with me, looking at developing ways to utilize AI to do one of two things. I've said this before, blockchain maybe remains to be seen, to either increase the effectivity of our healthcare industry, better diagnosis, better accurate treatment planning, yada, 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 or the efficiency, the output of how many patients we can see in a year, in a week, in a day. And that's our kind of MO. But fintech is pretty straightforward, and that's what it is. That's where we are, and that's where we're starting. Cool. How much time do we have, if any? 3 minutes for questions. Do we have any questions from the live streams or something, or? No questions at all. Even about human extinction. Okay. Okay. I don't have much more to say unless anyone has any questions. Cool. Thanks very much, guys. Thank you so much. Cheers. Thank you. Cheers. How's it going?
Great. Sure.
Thank you.
It was,
Thank you. You
Yes.
came a little bit late into the
Yes.
thing, but that's fine. I mean, it's tough.